And we'll finish off our panel today with Nicholas Hamzea, who is an incoming first-year Western University student in the Medical Sciences program. His non-academic pursuits include volunteering with the Holland Bloorview Kids Rehabilitation Hospital in the Therapeutic Recreation Unit, being a medical first responder with St. John Ambulance, and serving as his school board's 2019-2020 Student Trustee. Here he is with a look at the impact of the internet and misinformation on COVID-19.
Great, thank you very much. All right, so hello everybody, welcome to my presentation. Today I'll be speaking about the impact of the internet and misinformation on COVID-19. So just about a brief introduction. I'm sure none of us need an introduction to the COVID-19 pandemic as a whole by now, as it's very evidently devastated the world, left millions infected and hundreds of thousands more dead. However, what a lot of people may not be realizing is that it's almost brought with it a second pandemic, and that being the pandemic of misinformation. Now, this is what I'll be covering in this presentation today, and for the purposes of this presentation, misinformation is going to be defined as false, inaccurate, or otherwise misleading information, especially when it is meant to purposely deceive an audience. Now, the current situation has highlighted the influence that the internet and media have come to have on our population, with misinformation spreading fiercely online and having dangerous consequences. As a result of the misinformation that's been perpetuated by individuals and groups alike, people are refusing to take vaccinations, taking remedies or drugs that are not proven to work, and ignoring public health directions, just to name a few of the ways in which the fight against COVID-19 has been harmed up until this point. Now, when looking at how people consume information, it's not surprising to see why this is the case. In the early months of the pandemic, posts from the World Health Organization and the Center for Disease Control have only received a few 100,000 engagements, whereas hoax and conspiracy theory sites have amassed over 52 million engagements. Evidently, the power of misinformation is unlike anything else, and it's proven this time and time again, as COVID-19 is not the first pandemic in which it has played a role. For example, after groups in Denmark and Ireland broadcasted testimonies of the human papillomavirus (HPV) vaccine harming young girls, national immunization rates for the virus in Denmark fell from over 90% in 2000 to under 20% by 2005. Additionally, it has also damaged the efforts with the HIV/AIDS epidemic, as in its early years, rumors and conspiracy theories about the virus spread to such an extent that it influenced the South African government to deny the legitimacy of HIV in 2004, and consequently deny antiretroviral therapies to thousands of mothers. It is estimated that as a result of this, over 343,000 people have died. So moving on, this is just going to be a little bit of this is just going to be what we were covering today in my presentation. And I'm beginning with the role of the internet as a whole and misinformation along with it, and this being through social media, the web, and media outlets. I'll be moving on to the context for the COVID-19 vaccine specifically. Excuse me. And then I will be talking about how we can combat this misinformation at a societal and at an individual level. Okay, so the role of the internet. So social media may arguably be the most powerful tool for the communication of information, but this means that it can have both positive and negative consequences. Although it provides a unique and invaluable opportunity to connect with one another across the globe, it also gives everyone, including those without proper expertise on certain subjects, the ability to make claims which can then be spread without any sort of verification. This means that it is also one of the most effective ways through which false and fear-mongering information can spread to millions of people. The primary issue is that misinformation spreads faster than information from credible sources, thus damaging the authenticity balance of the news ecosystem. And since people tend to act and operate based on the information they receive, and when this information is false, those actions can be detrimental. In fact, many instances of racism and xenophobia, mass panic, and misleading rumors regarding COVID-19 can largely be attributed to social media. Now, unfortunately, the prevalence of social media and its role in this pandemic differs greatly from previous pandemics such as MERS and H1N1. This is because, unlike before, rather than members of the public simply consuming inaccurate and misleading information, And they are actively spreading and even creating it. According to Lee Kum-Kee, who is a professor of health communication at the Harvard T.H. Chan School of Public Health. He then goes on to state that, quote, the sheer volume of COVID-19 misinformation and disinformation online is crowding out the accurate public health guidance, making their work a bit more difficult. Claims such as this are backed by scientific studies, as demonstrated by one that looked at 673 different tweets related to 14 trending hashtags and terms in order to assess their credibility. Now, the result of these tweets, 153 included misinformation and 107 included unverifiable information. Now, in addition, a staggering 448 tweets were made by informal individuals or groups. If we look in the talking about COVID resources channel, I have posted a link to this study, which goes far more in depth regarding these specific results, as it's far more than I can cover in a simple presentation. Now, with so many of the most popular tweets containing false or unverifiable information, it's no surprise that misinformation can spread so rapidly. Moreover, an average user may see the same false or misleading information coming from different accounts or groups. Its frequency may then give more credibility from the perspective of the user and increase the likelihood of them sharing. Moving on to the web. The problem with the web is that in this day and age, the internet provides anyone with the opportunity to publish anything that they wish online for others to see. This means that it is impossible to inherently trust websites. For example, a study was conducted that analyzed the first 110 Google searches for Wuhan coronavirus. This was done back in early March, before COVID-19 as a term was widely used. Now, this was done using the Health on Net Foundation Code of Conduct, (HON-Code), the Journal of American Medical Association JAMA benchmark, and the Discern instrument. HON-Code aims to standardize the reliability of medical and health information available on the World Wide Web and provide certification. And JAMA uses 4 core standards to evaluate websites, these being authorship, attribution, disclosure, and currency. Now, Discern is an instrument or tool that has been designed to help users of both consumer health information judge the quality of written information about treatment choices. Of the 110 sites analyzed, only about 1.8% had the HON-Code seal, and 39% met none of the standards set out by the JAMA benchmark, while only 10% met out all 4. And additionally, the Discern instrument evaluated 70% of the websites as having a low score and did not give a high score to any website. Now, this evaluation demonstrates the ease with which misinformation can be spread across the internet, as the first 110 sites have shown little to no reliability in the information that is being conveyed. Moving on to media outlets, the third and final prong of how misinformation can spread through the internet. The media also plays a large role in the spread of misleading information and information that generally only focuses on one aspect of the larger picture, as people generally rely on news outlets, which gives them a larger degree of perceived credibility. Moreover, these media outlets have all their own biases and agendas, which may motivate them to publish information that favors a particular side, and are often looking to increase views and ratings. Unfortunately, humans are generally attracted to negative news, meaning that this is known as negativity bias, meaning that there's no surprise that these types of stories are most prevalent in the media. In the context of COVID-19, this can be more of a focus on negative events and disasters related to the virus, which will only serve to spread panic. Additionally, individuals who are normally more fearful or anxious pay more attention to threat-related information, and the volume of COVID-19 coverage coupled with media bias results in plenty of opportunities for those with higher fear of contamination to focus on the threatening aspects of the outbreak. Regardless of the individual, however, the focus on negative stories and the subsequent mass panic has led to a slew of consequences. For example, many people rushed up to stockpile on resources such as food and toilet paper, leaving shelves empty. This was unnecessary and harmful, as it led to not only vulnerable individuals such as the elderly and immunocompromised not being able to purchase necessities, but also to crowding in stores, which may have contributed to the spread of COVID-19. Similar consequences were seen when CNN published a report on March 8, 2020, stating that a region in northern Italy will be locked down to contain the spread of the pandemic. However, this was hours before any official communications from the government and led to citizens panicking and overcrowding trains and airports, potentially aiding the spread of COVID-19. Overall, it's clear that media outlets have a profound impact on populations, but ulterior motives such as bias and pursuit of ratings, the level of power that they hold, can, unfortunately, harm populations on a large scale and increase the devastation caused by the pandemic. I'll now be speaking a little bit about the COVID-19 vaccine specifically, as it's been the target of a lot of the pieces of misinformation online. Now, the anti-vaccine movement is by no means a new concept, but with the COVID-19 vaccine being currently in development, it is no surprise that this is one of the most significant opportunities for misinformation and public pushback. In addition to the general anti-vaccine arguments that are often made by opposing groups, such as the claim that they cause autism or a slew of other health complications, the COVID-19 vaccine has come with some rumors of its own. Some of the most prominent pieces of misinformation currently making their way across the web are rumors surrounding Bill Gates' involvement with the virus, with individuals and groups claiming that he created the virus and patented the vaccine, or that he would use these vaccines to track and control individuals. Another demonstration of just how widely misinformation spreads comes from biohackinfo.com. And this example is perfect in demonstrating how, although each of these three prongs can be devastating in isolation, they unfortunately often work together and therefore magnify the negative impacts of and only serve to amplify the spread of misinformation. So on March 19th, 2020, biohackinfo.com, an unreputable source, claimed that Bill Gates was using the vaccine to implant tracking chips into patients. Within 2 days of that, attention was turned towards a YouTube video about the matter, which had since been viewed over 2 million times. Now, this idea eventually reached Roger Stone, who is a former advisor to President Donald Trump, who discussed the matter on a radio show and claimed that he would never take a vaccine that was funded by Bill Gates. This interview was then covered by the New York Post in an article which was liked, shared, and commented by nearly 1 million people. I'd like to point out that in this article by the New York Post, the claims made by Roger Stone were not debunked, but rather further spread. Soon after, many high-level profiles with large followings on all sorts of social media commented on the matter, further spreading this misinformation. The final result of this? A false claim made on a website with no credibility, spreading to millions of people in just a matter of weeks. As you can see, evidently, the web, as this is where it started, social media, along with the news outlets, were able to magnify a simple and small piece of information to millions. And the damage caused by this is potentially unknown and unmeasurable. So now that we've talked a little bit about the devastating effects of the misinformation has had on this pandemic, let's talk about a few of the things that can be done to combat it. Begin first by highlighting the measures at a societal level. So the duty falls on everyone to limit its spread, and we can do things on both an individual and societal level. On a broader level, one of the first measures that must be taken is to provide healthcare workers with current and accurate information regarding COVID-19. This will not only allow them to provide better care, but they can also communicate this information to patients. In order to achieve this, however, a system will likely need to be developed to make this information easily accessible to healthcare workers and to the general public. Additionally, citizens may place more trust in the information they hear directly from their doctors, which will hopefully reduce the spread of misinformation. Another step that can be taken is for major media and information companies, including social media companies, to coordinate with one another and to individually develop a method to tag posts containing misinformation and warn users to be cautious with how they interpret the post. This is already seen on a variety of platforms such as Facebook and Instagram, and all sorts of technologies ranging from hiring fact checkers to even artificial intelligence are being employed in order to do this. The final and arguably most controversial measure that can be taken is to remove all misinformation from the internet altogether and ensure that only scientifically sound misinformation is made available to the public. Now, the reason I say it's the most controversial is because although this may be the strongest tool for removing misinformation, it also has the most potential problems. The most significant concern with this is that it can be considered censorship and clashes directly with freedom of speech. Freedom of speech is one of the most fundamental principles of democracy, and the argument can be made that it should not be undermined, even if false, because even if false, people have the right to share what they believe. Additionally, it would require citizens to trust and give more control to the government, an idea to which many citizens may be opposed. This also may present an opportunity for those who are against the measures being taken by the government to stop the spread. Those who are against the measures being taken by the government to stop the spread of COVID-19 to further convince others of their viewpoint, as they may claim that the government is quote unquote doing this as a cover up. Unfortunately, the unorthodox nature of censoring misinformation or information as a whole in a democratic nation, as not done for misinformation related to any other topic, may give credibility to these claims made by those opposed to this, and this can result in greater public backlash. If the decision is made to censor misinformation, there will surely be a great deal of controversy and outcry, regardless of the benefit it brings. So those are the measures that can be taken as a societal level. However, there's things that every individual can do to minimize the role they play in the spread of misinformation. First and foremost, it is important to ensure that the only sources that are being consulted are credible ones. For COVID-19, this can include sources that are such as government and public health websites, university pages such as that of Johns Hopkins University, or research articles found through a variety of online databases. Additionally, individuals should cross-check any information regardless of whether or not that source is credible with other credible sources to ensure consistency as what is being reported, as even credible sources sometimes make mistakes and may report something that is misleading or false. Any information that is presented by a news outlet or an individual, whether it is online, on TV, or anywhere else, should be individually verified first before it is reposted. The hope with these measures is that if everyone here were able to take a few minutes to research a topic or claim for themselves before reposting information, the spread of misinformation could be significantly hindered. Now, overall, it's become evident that there are currently two pandemics descending on the world: COVID-19 and misinformation. This has led to a plethora of negative consequences that have not only undermined the fight against the virus, ranging from people not listening to public health guidance and refusing to take vaccinations, all the way to even increasing the spread and potentially actively killing individuals and populations. Misinformation on the internet is by no means a new phenomenon. Both the number of social media and internet users exponentially and constantly rising, it is poised to be more dangerous than ever before. In order to reduce its spread and to subsequently reduce the spread of COVID-19, every individual must play their part and actively seek out credible, scientifically sound information while ensuring that false or misleading information is not shared or reposted. Thank you very much. So here are just the references that were used for this project, and I'll be more than happy to answer any questions at this moment. Thank you.
Thanks, Nicholas. The next question then will be for Nicholas. It'll be from Alexandra. Do you think government policy should play a role in regulating the spread of misinformation, and to what extent?
Great, thank you very much. That's an excellent question, by the way. So I personally believe that and this is actually what we're seeing, that the regulation of misinformation is largely left up to the individual media companies. So we're seeing companies such as Facebook, Facebook and Instagram work together, but such as Facebook and other news outlets, beginning to actually post warnings and to remove instances of misinformation and fact check on their own. So I personally believe that it should be left up to the individual media companies for the most part, as as every method is different. For example, it might be the methods used to regulate a website might be very different from social media, and with social media in particular, it is best left up to the companies. However, I do think a government policy should begin to play a role, in the sense that the government should. The government should put some sort of policies or requirements in place to require that information is independently fact checked before it is spread by major news companies and groups that have a large degree of influence over the population.
Great, thanks. To continue on that, Zach has asked, how do people tell the differences between credible and non-credible information when they have no background in academics or science?
Another excellent question. I think this question kind of highlights one of the major issues with the spread of misinformation right now is the fact that a lot of people do not know how to, since they do not have a background in academics or science, they do not know how to check for themselves, and this leads to them reviewing a post, for example, and then posting it, even though it may be misinformation. What I would personally do, and like the personal advice that I would give, is that anytime there is some information that comes up online, primarily through social media, as it seems to be the biggest channel for the spread of misinformation, is to use search engines such as Google, yet primarily search engines such as Google to cross check or to see if one other news sources are reporting the same, and then reviewing those credible sources. So, for example, government and public health websites, which can be easily accessible, or university research pages, just looking to see if they can find the information that they came across on social media or on the news or wherever they're looking, to see if they can find some backing on the government website, on the CDC website, or on a university page.
Awesome. Thanks so much.